And thank you both, Dr. Weber, Mike, thank you both so much for coming on this morning. What an important topic we have here to discuss. Mike, first, we know Dr. Weber's involvement with it. Why did you want to speak about this topic?
Well, I wanted to speak about the education that was needed about this. I was diagnosed about 6 years ago with type 2 diabetes, and my doctor had told me some of the things to do were, I was overweight at that point after playing football for a number of years, was exercise and lose weight. And I kind of put those two together in a bad way. I didn't eat before a workout, and I worked out very hard to try and do what the doctor wanted. And I had a low blood sugar episode, because you think of high blood sugar with diabetes, but this was a low blood sugar situation. So I needed education. That's why I wanted to get involved. I didn't have bloodsugarbasics.com, the website that we're talking about, when I was diagnosed 6 years ago, but now we do have it, and we have it as an educational tool for everybody to understand what they have.
Now, Dr. Weber, when folks first start coming in with symptoms, what do you tell them? How quickly is action needed for each individual?
Absolutely. Let's start out on the front end of that. What circumstances do you get into when you have low blood sugar? Well, certain diabetes medications, maybe skipping a meal, maybe you were working through lunch, or exercising intensely like Mike did. Now, in those circumstances, you can get a low blood sugar, something we would like to be more proactive about and be able to prevent. But if you do get one, what do you notice? Nervousness, sweaty, shaking. And if you have those symptoms, you want to recognize it immediately and treat it immediately. You don't want it to progress on to something more serious, like passing out, having seizures.
All right. And Mike, once you started taking the right approach to these things, I think that folks who follow your career and see you, well, they hear you on air, but we also check you out on TV. We've noticed that you've trimmed down. Do you feel healthier? Do you feel better now that you've started tackling these symptoms in the way that the doctors really want you to?
I'm 48 years old, and I feel like I'm in the best shape of my life. I'm running a lot, I'm moving, and everybody moves in a different way. But I'm eating properly. Listen, I want to stress, you can live a normal, regular life. You know, when you talk to most people about healthy living, it's 5 to 6 small meals a day. Well, that's what I do. I do the same thing everybody else does. It's just knowing when to eat them and how to use it with my progression. I was over 315 pounds at my heaviest, and now I'm in the low 260s, and I feel fantastic. But education is the key. And with the American College of Endocrinology and some support from Merck, that's why they started this website, bloodsugarbasics.com, to educate. I didn't have that. I had the ego of a professional athlete that said, I can handle everything by myself. Well, you know what? You can't. And if you have this or other things, you need to work with others. Work with your doctor. My doctor is now my coach. That's who I work with. That's who I have my game plan with. And the website helps you, your family members as well, get educated, and that's key.
You know, Mike, now that you've done my show, I'll finally go on yours. So you just let me know, and I'll grant you that interview that you requested.
I'll have my people call your people.
All right, please do. Thank you both so much for your time this morning.
Thanks.